Now, to clarify, if you have this procedure where you take out the gland, because and speaking specifically towards bodybuilders, there are certain agents and drugs that people will use to try to combat the gynecomastia without having to take the surgery. Now, is it possible, from a doctor's point of view or perspective, if you were to have the gland taken out, to have the gynecomastia resurface or come back at some point, possibly due to agent use, drug use, or any other factor? Is that a possibility, or is it an end-all fix?
Oh, I think it could come back. I actually was just talking to a guy who said his got bigger and smaller. He was a competitor, and he said he had talked to people who had had it removed, and it still did come back because there are small remnants. You can't take everything because I'm looking at the muscle when I go in there. I take things down to the muscle. I see your pec muscle, and I've even shown it to guys while I'm doing it. You can see the muscle sitting there. So I go down to the muscle, but you can't just remove everything off the muscle, or you'll get a scar that sticks down to your muscle and it'll look artificial. It'll look like you had something done. So you want to leave a slight layer of gliding tissue under there so that you look natural. You don't want to look artificial or unnatural. And that tissue that you leave behind certainly could have a little bit of that glandular tissue in it. If someone didn't use stimulants that were stimulating it, it probably wouldn't come back. But if they were continuing to do whatever caused it, you would think it might come back, and you just treat that symptomatically again.
Okay. So to clarify, yes, it seems like if you are using drugs that may instigate the issue, then that issue would not be 100% resolved by just having it physically removed by a doctor. All right, so keep that in mind, guys. I know that's a very common misconception when it comes to bodybuilders. If I get it taken out, could it come back? And the answer seems to be, if you are taking drugs, there is a possibility it might. Now, what I've noticed in bodybuilding is that the side effects that you get from drug use, if you're using drugs, are really independent for each different person. It's very individual. So I feel like, as a natural bodybuilder who had gynecomastia growing up and had to get it surgically removed, if I were to take drugs, I'd most likely be prone to having gynecomastia as a side effect. I've also had really bad acne, and I feel like that would be even worse or amplified if I were to take drugs. So there's types of people who I've noticed who can take drugs and have very little side effects.